Okay, so day of the surgery. Again, consult your doctor. I am not a doctor. What happened for me that day may or may not happen for you. So take these with a grain of salt, but this just gives you a little bit of an idea of what happens. I had one of the first appointments of the day, so I had to get up early and get out there. And got there just in time. And so I checked in, I did my co-payment. I think I had to sign a form. And then the next thing they did, which I was not aware of, is they want to have a urine sample. I don't really know how this is supposed to work since you're supposed to stop drinking liquids at a certain time. And so I was scared that if I couldn't, then the surgery wouldn't happen. So check to make sure if you have to do that and what the best way to make sure it can happen, or if you can't, will the surgery still happen? Because I really don't know. Luckily, that was not a problem for me. Um, then they weigh you, they take your height, they take your blood pressure, the normal stuff they do at a doctor's visit. Then they'll have you change into robes and get into one of those beds, and they'll put an IV in your hand. They'll have you choose which hand. I had my left, and I think it was basically just like water or stuff to keep you hydrated. I it wasn't any sort of painkiller or anything like that. My surgeon was running late from a prior surgery, so it was a bit stressful because I talked to my surgeon before about having anxiety towards going under and all that, and they were saying that they could give me a little something to help with the anxiety, but apparently they can't give it to you until your surgeon is there and ready to go. And I ended up waiting, I'd say, at least a couple of hours, so I had to keep calm, I had to breathe. My friend who drove me was still there, so I talked to them to distract myself. And it was a very long time until I saw my surgeon, but they finally showed. And then they'll take you into a room where it's just you and them, and they'll draw on your chest to figure out where things are going to go. And after that was done is when they finally gave me something for my anxiety. Um, I've heard other people say that they're like tripping out when they have that. It didn't really do that for me. I just felt like my anxiety was here. It brought it down to a more manageable level, but I was still very much aware of what I was doing, what I was thinking. I wasn't like, woo! I wasn't like that, which I'm glad for. But after that, they wheeled me into the surgery room, uh, and they have you get on the table yourself. It's just from one bed to the table, so it's not difficult. And after that, I was out, and the next thing I know, I'm waking up. Before waking up, it felt like one of those days where you wake up early before your alarm and you just want to keep sleeping, and you're just like, hit the snooze, hit the snooze. But eventually, I did wake up, but it was fine. Again, I went at surgery, I was out, and then I was awake. And I was asking the nurse there, is it done? Am I done? And they were saying, yeah, you're done, you did great. And honestly, that moment was one of the best feelings I've ever had in my life. Just knowing it was done, because I was so nervous about going under, and then it was done, and finally I had the chest I always knew I had, and that was pretty amazing. Um, so they'll give you something to drink at that point. Apples. I had the choice of apple cider or orange juice, but then I wanted apple, but they were out, so I had orange. They won't let you leave until you're able to drink something and keep it down, and then pee. Once you can do those two things, they'll let you go. And so they wheeled me out to a chair where I could see my friend again, and they were just waiting to see if I could pee and all that. And while they were doing that, I kept getting, they would ask, how are you in pain? And if I was, they give me something. But honestly, it just felt like I had a really hard workout the day before. I just felt really, really, really sore. Not painful, which is good. And for me, I actually started to have an allergic reaction to the whatever it is they were giving me. Um, the heart monitor was going, and I could hear it. And I've had an allergic reaction before, so I know like my throat. I know what it feels like when my throat starts to close up, and so I was like, oh hey, I think I'm having an allergic reaction, and I could hear my pulse start to go faster. And I know everyone around is trying to stay calm to keep me calm, but I could see them looking at the heart monitor, so they weren't fooling me. And I was like, oh, this is bad, but at least I'm in a hospital where this is the best place to have an allergic reaction. And they gave me something, and then I felt better and felt more normal, and my heart rate did go back down to normal, which was good. You will have to pee a lot after surgery, like the first 24 hours, I'd say. It's a lot, because I guess they're pumping you full of liquids the whole time, and then it's gotta come out, and there's a lot of it. So that was awkward and uncomfortable, but hey, I was able to leave. They'll give you a bag of ice to put on your chest for a little bit, which they let me keep for the ride home. I had it on for like 10-15 minutes, and then, because I was in the car, and then I was just out. I was asleep. I slept all the way home. I got home late because that allergic reaction really added up, and later than I thought I would. And my friend showed my mom how to, my mom's the one who took care of me. They showed my mom how to empty my drains, because you got to empty them, like, I think a couple times a day, like evening and morning, and they have you measure it, and once, because it's emptying blood, so if you don't like seeing blood, maybe don't look down, have your shirt on and don't look down. And once you're only letting out a little bit of blood, a certain amount, then they'll take the drains out. And again, I was not in any pain. I did the heavy painkillers for like 3 doses, and then I psyched myself out thinking I was having an allergic reaction when I wasn't. So then I just went on, I think it was Tylenol. Again, check with your doctor if Tylenol is the right one to have, because you don't want to take the kind that makes you bleed more, because you don't want that. Yeah, I was really sore, and I honestly couldn't even like lift my arms past here. I could not take my glasses off. I couldn't, I think I could just barely scratch my nose if I needed to. I couldn't turn the sink on and off, I couldn't apply pressure to liquid soap to get the soap out, so I needed help there. I couldn't sit up or lie back down on my own. I needed someone to help me get up, so I was basically bed-stricken until someone could help me get up and out of bed. And like lifting the seat up on the toilet, couldn't do that. Couldn't push the flush, but other than that, I could do everything on my own, thankfully, because that would have been embarrassing, and I wouldn't want to have done that. And then, yeah, that's pretty much all I have for day of. In the next one will be post, and post goes on for a few months, so what may or may not happen for you, and that'll be